Hi, my name is Norwood Davis, and I've been a licensed insurance agent since 2001. I'd like to show you how you can save up to 40% on your health insurance premiums each and every month. As you may already be aware, that the ACA Affordable Health Care rate increase is expected to go up again an estimated 19% or more this upcoming open enrollment year. At this time, I'd like to introduce the Craig Agency to go over how you can keep more money in your pocket this year. Please watch the whole video presentation until the end. We have a special gift for those individuals that complete the overview. Thank you.
Welcome to the Craig Agency's presentation on the New Era Health Insurance Programs. Let's begin by taking a look at the average cost of a hospital stay. This study is done by the Kaiser Family Foundation. Let's look at California at $3,341, Florida $2,087, Georgia 1,067, Tennessee 1,704, and Louisiana 1,782. If we look at the average day stays in those states, it's about 5 days, except the state of Georgia, which is 6 days. We study these numbers to know what the average costs are and the average stay. Take a look at your state and see what the average cost per day is and the average number of days in the hospital. By knowing this, it helps us understand the costs. Let's take a look at the insurance company behind the plan. AM Best, a leading rating company for the insurance industry, has rated Philadelphia American B++ good with a secure financial outlook. We're going to discuss the plan called Health Choice Select. It falls under the heading of New Era Health Plans. It's an affordable approach to healthcare with comprehensive protection and is consumer driven. Again, Health Choice Select is a comprehensive insurance plan. Let's take a minute to understand what that means. It's first dollar fixed benefits coverage and not a major medical insurance plan. Since all the benefits are covered in the plan, it allows you to know exactly what the policy pays for before you access services. It's guaranteed renewable, so you cannot be canceled as long as you pay your premiums. Health Choice Selects allows you to custom design a plan to fit your needs and your budget. We looked at the cost of hospital stays and how many days it would be, so you can design your plan by where you live and what your cost bases are. First day hospital confinement. While people are very familiar with deductibles and copays in major medical plans, there are no deductibles in this plan. You can, however, choose to elect a copay for your first day hospital stay, first day only. Later in this presentation, you'll see how this works to save you premiums if you so choose. Annual benefit you select. This is similar to choosing liability on your car, home, or life insurance. As your policy renews annually, Philadelphia American reestablishes your benefit. This is another way for you to control and select your benefit and control your costs. Prior, we addressed covering the cost of hospital stays. This plan also covers ICU, mental health, outpatient radiology, chemotherapy, rehabilitation centers, and outpatient surgery or ambulatory centers. Review with your agent the detail of each category as it relates to how you wish to design your own plan. Outpatient benefits are covered as well. MRIs, CAT scans, lab tests, x-rays, emergency room, urgent care centers, prescription card program. Preventative care is included. 20 physician office visits are included yearly, 6 of which can be used at a chiropractor's. Ask your agent for details and understand how this part of the program works. Pre-existing conditions. How a pre-existing condition affects coverage. What is a pre-existing condition? A condition in which treatment was recommended or rendered by a physician for which drugs or medication was prescribed within 12 months prior to a covered person's effective date and will not be covered for the following 12-month period. It is important to note that pre-existing condition applies to all benefits with the exception of preventative care. Pre-pricing is still available through the PPO network. Now let's discuss value added benefits. Let's talk about Teladoc. Teladoc is truly new era medicine. You have access to a physician 24/7 all across the USA and no cost to you. You must pre-register once you are enrolled, but then avoid sitting in physicians' offices for non-emergencies. Travelers and road warriors alike appreciate this convenient services. Ask your agent for more details on this fantastic benefit. ScriptSave is another value-added benefit. It is more than a discount prescription card. You can go online, put in your zip code, name of your prescription, and get a cost comparison at the pharmacies in your area. This is another example of consumer-driven savings healthcare, part of the new era of healthcare protection. Advocating for the patient. Caris Healthcare Navigator and the Caris Surgery Saver are both programs included in the plan. They are to help you save money, get the best of quality services, and know exactly what the costs are for you, the insured. A second area of assisting and saving costs is the PHCS network multi-plan. While you can go to any physician in the country that's licensed or hospital, using this network will save you money. PHCS network is national. It has top hospitals, physicians, and services throughout the United States. Let's look at some claims with Health Choice Select using the PHCS network and see how it works. As we look at a claim, we should understand what a CPT is. It is a coding system developed by the American Medical Association in 1966 to identify every procedure and therapy. It is still used today by insurance companies and Medicare. So reviewing this bill, we can see that the billable charge is $17.85, yet the approved amount is only $896. This is close to a 50% savings to the insured. Now let's take a look at a metacarpal fracture. Under the coding system, the approved rate would be $10,100. With the discount plan with multi-plan, it's only $43.61 for our insureds. This is a 56% savings. Here is an actual claim. We're using the old plan that had a $2,500 deductible. The new era Health Choice Select has no deductible. Let's review this claim. The insured was in the hospital for a bowel obstruction, 11-day hospital stay, 7 of which were in the IC unit and 4 days in a semi-private room. 11-day stay in the hospital would have been $56,379 based on coding. With the discount with the multi-plan in our program, it dropped the bill down to $12,235. Since Health Choice Select pays out based on fixed amounts, the insured would have received a $7,014 check after all the bills were paid. Using the new plan with no deductible and a copay for the first day in hospital stay, the insured would have received a higher amount above the $7,000. Talk to your insurance agent and understand how this program works. It is designed to be consumer friendly, get you the best coverage, and save you money. Healthcare Blue Book is also provided to you, the insured, to help you find the best procedure for the best price in your area. This is an example of how Healthcare Blue Book works. You simply put in the procedure you're interested in pursuing, your zip code, and it will give you the pricing of that procedure in different facilities in your area. This is another example of how New Era Health Insurance works. It is designed to be consumer friendly and save you money. There are two additional parts of the health care plan that we feel very important to include in your planning. The crisis recovery or critical illness policy, along with the accident expense plan. Both of these plans we feel are extremely important to include in your coverage. Discuss them more in detail with your agent. What's next? Pick your plan design with your agent. Discuss in detail the plan. Complete the medical application with your agent. Submit the banking information for a monthly draft and a completed email verification or phone verification. It is important to discuss these details with your agent and pick the plan that makes sense for you. This presentation was designed as an overview and not intended as a detailed discussion of the plan or its options. This plan is not a major medical plan. Coverage may vary by state and may not be available in your area. This plan was not designed for everyone. Speak with your agent for more detail.